Good day, everyone. Thank you for joining today's webinar. We are still waiting for colleagues to join us, and we will start shortly. So just wait a bit. Thank you. For those who just joined in, thank you for joining today's webinar. We're still waiting for colleagues, a few more colleagues to join us, and we will start shortly. So just wait a bit. Thank you very much. Hello, everyone. Thanks for already posting your name and your location and organization. Thanks for joining today's webinar. We're still waiting for a few more colleagues to join us, and we will start shortly. Good afternoon, good morning, and good evening to everyone. We welcome you all, particularly those of you joining from different locations from far away or in very early or late times. Thank you for joining today's WHO EPIWIN webinar on One Health Intelligence, Global Collaboration for Emerging Health Threat Detection. Today's webinar is part of a series of EPIWIN webinars on One Health. For those new to EPIWIN, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. Our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Before we introduce our speakers and panelists, we would like to express our deepest sympathy to the family and colleagues of Dr. Faustine Ndugulile. Dr. Ndugulile came from Tanzania and was nominated for the post of Regional Director by the Regional Committee for Africa in August 2024. He was a medical doctor, parliamentarian, former Minister for Communication and Information Technology, and Deputy Minister of Health. He passed away this week at the age of 55 and is survived by his wife and 3 children. From the EPIWIN and CRR and One Health team, we offer our condolences. Today, we have a great panel of experts to discuss One Health intelligence. My name is Lester, and I will be hosting today's webinar. For our speakers, we will hear from Dr. Maria von Kerkhoff, Director of Epidemic and Pandemic Prevention and Preparedness in WHO Geneva. She will give us the welcome and opening remarks. And then we will hear from Dr. Montserrat Arroyo, Deputy Director General of the World Organization for Animal Health, who will give us an introductory overview of One Health intelligence. And then we will hear a presentation from Dr. Dunia Salanik, Team Lead of Public Health Intelligence in WHO Geneva. Her presentation will be on BLUES Plus, the joint FAO-WHO WOA Global Early Warning System for Health Threats and emerging risks at the human-animal ecosystem interface. After the presentation, there will be a panel discussion, and we have subject experts with us today. We have Dr. Ismaila Sek from FAO. We have Dr. Itlala Gizo, also from FAO. And of course, we have Dr. Dunia Salanik. And we are also supported by Dr. Eliza Palamara from FAO. And then we will close with Dr. Madhur Dingra, who is the lead of Animal Health Prevention, Preparedness, and Response from FAO. Before we proceed, here are some housekeeping and reminders. This webinar will be live streamed on the EPIWIN YouTube channel. We are also recording this webinar, and after the awards, we will make this available in our website and also through your emails. So we invite you all to post your name, location, and organization in the chat box, and we would love to hear where you're coming from. If you have questions, please include these in the Q&A box, not in the chat, so we can keep track of them. Usually we have a lot of questions from our audience. As in our previous webinar, we want to know a bit more about our audience, about you. So to do that, I'll turn over to my colleague, Sophia, to give us a very quick Slido survey for our participants. Sophia, I'll turn over to you.
Thank you, Lester. So like Lester said, we would like to understand a little bit more about you, our audience. So please either scan the QR code on the screen or participate at slido.com with the number 9762724. So we'll give everyone a few moments to join and participate. Again, to participate, please go to slido.com with the number 9762724 or simply scan the QR code. Okay, so we've had about, we have more than 100 participants responding, now 130, and it looks like majority of you work in human health, a bit more than 10% working animal health, and less than 5% working in environmental health. Okay, and 2% work in related areas. That's great to know. And now looks like we've had about 230 participants responding. We will continue to leave the Slido open. And now I turn it back to you, Lester. Thank you.
Thank you very much, Sophia, and great to see the variety of our audience, more than 75% in human health, but really great to see colleagues from animal health, environment, and other areas. So without further ado, I turn over to Dr. Maria van Kerkhoff for the welcome and opening.
Thank you so much, Lester, and thanks to the whole EPIWIN team for the opportunity to be with you guys today. Good morning, good afternoon, good evening to people all over the world. It's really my pleasure to give these remarks on behalf of WHO, and I send apologies from Dr. Abni Muhammad, who is not able to join you today. Thank you very much for mentioning the condolences for our RD Afro-elect. It is a deep shock, and I also send my condolences to his family and friends. To the webinar today, we are witnessing a growing global pattern of health threats that are more complex and interconnected than ever before. Public health emergencies are happening more frequently and with greater severity, often driven by zoonotic diseases and other emerging risks at the animal-human interface. Pathogen spillover from animals to humans is becoming more common, triggering large-scale infectious disease outbreaks that have now become a regular occurrence rather than the exceptional event. In this reality, pandemics can no longer be regarded as once-in-a-lifetime events. This reality highlights and reinforces the urgent need for robust early warning systems that can quickly detect, assess, and respond to health threats. WHO, FAO, and WOHA, through their tripartite collaboration, have been leading efforts to tackle these challenges for many years. Emerging health threats and pathogens with epidemic and pandemic potential do not respect physical nor political borders. They require timely and reliable intelligence to inform prevention and mitigation strategies. Collectively addressing this need is a key priority for the tripartite collaboration and is the focus for today's discussion. At the core of these efforts is GLUES, the joint FAO-WOHA WHO Global Early Warning System for Health Threats and Emerging Risks at the Animal-Human Ecosystem Interface. GLUES embodies One Health Intelligence by detecting, verifying, and sharing critical data and expertise across human and animal health sectors. These efforts strengthen early warning systems, enhance decision-making and risk assessment, and provide countries with actionable recommendations to mitigate risks and prevent epidemics. Coordinated global action is crucial for detecting, assessing, and addressing health risks before they escalate. The tripartite collaboration exemplifies the strength and collective action with WHO, FAO, and WOHA pooling expertise and resources to share critical One Health intelligence. Excuse me, I'm a little under the weather. So I'm just recovering from a cold. Today's webinar will delve into how One Health Intelligence is operationalized through GLUES, highlighting the unique contributions of WHO, FAO, and WOHA in supporting global early warning systems. Our colleagues will share insights into how these organizations under the One Health umbrella exchange critical information, conduct joint risk assessments, and provide evidence-based recommendations to strengthen preparedness and prevention and response efforts for these emerging health threats. This shared commitment to collective action demonstrates the impact of the tripartite partnership in addressing complex health challenges at the animal-human ecosystem interface. It also highlights the critical role of WHO's public health intelligence activities in integrating human and animal health data to support early warning and response strategies. I invite you to actively engage in today's discussion, exchange ideas, ask questions, and explore how we can work together to strengthen global health security. I'm very grateful to welcome our distinguished colleagues from FAO and from WOHA, and also my colleagues from WHO, who will all share their insights as part of today's remarks. Together, WHO, FAO, and WOHA have been demonstrating the vital role of cross-sectoral collaborative partnerships and addressing emerging health threats and advancing the principles of One Health Intelligence. I want to say a special thank you to Dr. Montserrat Arroyo, Deputy Director General for the World Organization for Animal Health, or WOHA, and Dr. Madhur Dhingra, Head of Emergency Prevention System for Animal Health at the Food and Agriculture Organization of the United Nations, or FAO, as well as all of our core GLUES team members across the 3 agencies. Thank you so much for joining this webinar. I wish you much success, and please, like we said, get actively engaged and ask some very good questions. Back to you.
Thank you very much, Dr. Maria, for welcoming everyone and also for giving us the collaboration efforts between the 3 organizations and many more. So now let me introduce you. Let me announce Dr. Arroyo of WOHA for the introductory overview. Over to you, Dr. Arroyo.
Apologies, 2 seconds. I am having some problems.
All right, we can hear you.
I'm having some problems. I'm sorry. What?
Dr. Montserrat. Can you share your slide?
I'm sorry, my computer is frozen. 2 seconds, if you can give me 2 minutes.
All right, but we can hear you well. Okay. Or maybe it's best we can proceed to the next speaker, if that's
Yeah,
all right.
well, 2 seconds. I'm really sorry. Distinguished colleagues, thank you, Maria, my tripartite friends, Madur from FAO and Maria, and my dear guests connecting from all over the world. I'm really honored to be able to have some remarks on today's EPI-WIN webinar that is dedicated to One Health intelligence, and extend my deep thanks to the World Health Organization for inviting us to be part of this webinar and showcase the value and the mission of our common partnerships. At the World Organization for Animal Health, it is our mission to ensure transparency in reporting animal health issues, and we work to improve animal health and welfare across the globe. By collecting, analyzing, and disseminating veterinary scientific information, we encourage international solidarity in the control of animal health risks, and it is within this vision of solidarity that collaborating is essential. We understand that safeguarding animal health is inextricably linked to safeguarding human health, as well as the health of our ecosystems we share, and we need to work in a One Health approach. A great example of this collaboration started 19 years ago, when GLUS, the Global Early Warning System for Animal Disease Transmissible to Humans, was formally launched by the tripartite in Geneva, in WHO's headquarters, together with FAO and ourselves, the World Organization for Animal Health. Since then, there have been great efforts to improve and support the system and to have been implementing by adding value on the combination and coordination of tracking, verification, and alert mechanisms of the three organizations. We know that the weaknesses of early detection and rapid response for animal diseases and the inability to control major diseases at their source have contributed to the spread across borders of diseases of animal origins, and this is why GLUS plays an important role in the detection and prevention of global diseases. Since its establishment, GLUS has become a powerful mechanism that brings together the information and expertise that exist in our three organizations, WHO, FAO, and WA. It is a solid and robust mechanism for real-time information sharing among our three organizations. Through GLUS, we collectively detect, assess, and respond to threats early, even those from unknown pathogens that may pose an epidemic or pandemic risk. This system has enabling timely and coordinated action, improving our ability to mitigate risk and protect both human and animal populations from emerging diseases. As we face, and just like Maria said, an increasingly interconnected world, the importance of rapid, accurate information sharing cannot be overstated. GLUS represents a cornerstone of our preparedness and response efforts from a One Health approach, ensuring that organizations remain aligned and proactive in safeguarding health across all fronts. I really thank you for joining us today. I can see there's a lot of participants from all over the world, and I'm happy to see that we have participants representing the three sectors, and to be able to listen and on the showcase of the critical work that has been done with GLUS. I really wish you a fruitful and insightful webinar. Thank you so much.
Thank you so much, Dr. Montserrat, and also Dr. Maria for the overview, giving us the background and the history and the work of the three organizations for One Health and also for GLUS surveillance. So now let me turn over to the floor to Dr. Dunya of WHO for a short presentation on One Health intelligence for GLUS. Over to you, Dunya.
Thank you very much. Good afternoon, good morning, and good evening to all colleagues around the world. On the name of the tree organization, I will present One Health Intelligence under the GLUES Plus initiative and the role of GLUES Plus in the global health security. Next slide, please. This slide explains the creation of GLUES and the beginning of this tripartite collaboration under One Health Intelligence. GLUES, the Global Early Warning and Response System for Major Animal Disease, including zoonosis, was actually established in 2006, and the initiative was created to consolidate, develop, and use cooperation to address animal and zoonotic threats. The initiative activates the voluntary collaboration on FAO, WHO, and WOA, all working together to strengthen early warning and response capacity to benefit the global community. In 2010, during the 7th International Ministerial Conference on Animal and Pandemic Influenza in Hanoi, as a way forward to prevent future pandemics and zoonosis and antimicrobial resistance, tripartite signed a concept note on sharing responsibilities and coordinating global activities to address health risk. In 2012, GLUES activities were updated to a new system, which is current GLUES Plus, the joint FAO, WHO, and WA Global Early Warning System for Health Threats and Emerging Risk at the Human-Animal Ecosystem Interface. The transmission of GLUES Plus involved the collaboration of the alert and response mechanism of the three organizations into one system for One Health Intelligence. This integration was designed to avoid duplication of effort, streamline the verification process, and enhance coordination in responding to health threats. Next slide. The GLUES Plus objective is to enhance global health security through early detection, early warning, and transparency among organizations by sharing official and confidential information on disease outbreaks. This includes epidemiological data as well as the information that may not be provided by national governments. Monitoring disease helps track the progression of endemic, seasonal, and emerging disease, which allowing us to anticipate changes in disease pattern, and the main expected outcome are better prediction and prevention of zoonotic threat. The GLUES Plus team also leads tripartite joint risk assessment, working together with expert and technical teams from all three organizations, and the outcome are recommendation and guidance for country. The risk communication is shared not within and across these three organizations. We also share information with member states, with public, with the international community. Coordinated risk communication ensures that the public is informed and prepared for potential high-impact health events. Next slide, please. Next slide. So this slide actually presents overall GLUES Plus work, from disease tracking to risk communication and early warning. GLUES Plus has developed a comprehensive global health intelligence strategy focused on worldwide disease tracking through diverse detection methods and early warning system. This includes verification of events identified through these various disease intelligence activities, such as event-based surveillance, indicator-based surveillance, data sharing, and as well cross-sectoral collaboration among partners, along with official notification from member states. Risk communication and early warning regarding the health risks are coordinated by each organization, ensuring timely and effective dissemination of critical information. Next slide, please. So how detection of event is done? So each organization has internal mechanism for detection of events, which I mentioned in previous slide. However, all three organizations also use the epidemic intelligence from open source EIS system for event-based surveillance. Information retrieved on the EIS platform provides us access to all the latest publication and media articles. This helps us to scan and monitor a wide range of the hazards and events from one single location. The public health intelligence team at the WHO, where I work, daily scan around 6,000 articles using the EIS. Next slide, please. So the WHO PHI team which is responsible for public health intelligence, is also the team implementing One Health Intelligence within the GLOVES Plus. And that was presented on the previous EPI webinar on 31st of October. Next slide, please. So when the GLOVES Team Plus work is activated, how do we communicate from detection to early warning? We use GLOVES platform to share alerts, and the platform provides a secure messaging among us. Alerts on the events that triggers GLOVES are related to several factors: disease causing high morbidity and or high mortality in human and or animal, emerging disease with significant mortality and or morbidity or zoonotic potential, as well as an event associated with unknown agent and the first occurrence or recurrence of disease and strain. So this alert system operates as the real-time evaluation framework, aligning with One Health Intelligence to promptly identify and respond to health threat. The alerts posted on the GLOVES Plus platform are further shared for verification using internal mechanism for communication with our regional offices. Once alerts are verified, there became an event, and each organization informed their relevant technical team. The platform also serves as comprehensive database for tracking health events and conducting the epidemiological analysis. For even with potential for high public risk or animal risk or high social economic risk, joint tripartite risk assessment define the likelihood and potential consequence for animal and public health, providing key recommendations to support countries in disease prevention, effective response, and risk mitigation. Next slide, please. So during, and actually between the period of 2018 and 2023, there has been a significant rise in events involving emerging disease with significant mortality and or morbidity of zoonotic characteristic. So you can see in this chart in 2018, there were 10 events reported, but already in 2023, there was 40 events. Similarly, the sharp increase in events which are related to high mortality and or morbidity in human and animals was also increased from 1 reported in 2018 to 46 in 2023. Next slide, please. GLOVES has a list of over 200 priority disease, which are classified into different categories. So category 1, it's a disease with a high impact on animal or in human health, like zoonotic influenza, Rift Valley fever, or bovine tuberculosis. Then we have category 2, which is disease with a high impact on human health and a low impact on animal health, like anthrax, CCHF, Lassa fever, and other. And finally, category 3 are disease with a high impact on public health and in outbreak situation like COVID-19, leptospirosis, mpox, and other. Next slide, please. During the 6 years period from 2018 till the end of 2023, there was 243 alerts, of which 172 were confirmed and monitored events, and 71 alerts were later dismissed after verification. The existing data show us increase in the frequency and variety of disease events, including emerging disease like COVID-19, Nipah, and also Rift Valley fever. This highlights the importance of continuous surveillance and timely intervention to tackle new public health threats. Some events initially reported as unknown disease or mysterious disease, like journalists like to say, were later identified through further investigation and laboratory testing. Next slide, please. So this slide showed the data of steady increase in reported disease events from 2018 to 2019. In 2020, it was the drop compared to previous years, and this is likely was impact of COVID-19 pandemic. However, as you can see in 2023, The number of disease events is shown to be double than in 2022. The sharp increase in health events can contribute to several factors. First, it's GLU's team has more capacity. We extended our network to regional office. Also, there is possible that more events occur globally during this period due to rapid rate of urbanization and travel, increased animal and population movement, climate change, also virus evolution and adaptation. Additionally, improvement in surveillance system around the world, increased public awareness, and better responding capacities also contribute to higher number of reporting events. Next slide, please. On this slide, you can see events reported by region. The majority of events, 54%, are reported in Africa, followed by Asia, 28%, Europe, 11%, America, 6%, and Oceania with 1%. However, the number of reported disease in America's region was increased 12-fold over the 6 years period, and unlike in Asia, the number of disease was increased nearly 10-fold. Notably, the number of disease reported in Africa was almost tripled in 6 years. There was also increase in the number of disease reported in Europe, going from none in 2018 to 14 over the 6 years period. Next one. This slide, it's about joint tripartite rapid risk assessment. Decision to conduct this risk assessment is influenced by factors such as severity, novelty, and potential for global impact. It's important just to know that some risk assessment are publicly available, but some are still remain confidential due to sensitive nature of information included. Next slide. So GLU's core team hold a regular meeting once a month to ensure coordination, address update, and plan the next step. In addition to the core team, we have GLU's focal person located in our regional office to validate verification, data connection, and sharing of relevant information. And the last slide. So this is my last slide, and I will again thank you for your attention. And if you would like more information, please do not hesitate to reach out. Thank you very much.
Thank you so much, Dr. Dunia, for giving us an overview of GLUs from history, the process from detection to early warning, and the different objectives and activities like risk communication, and also some of the more recent information data, the increases. So now it's time for our panel discussion, and we're joined with our expert panelists. Let me call on Dr. Ismaila Sek, Animal Health Officer from FAO. Also, Dr. Itlala Gizo, Focal Point and Coordinator of GLUs from WOHA. And of course, we have Dr. Dunia Salanik from WHO. All right, so we have a few minutes, around 20 minutes for the panel. The first question we have here is for Dr. Ismaila Sek from FAO. We heard that GLUs was established back in 2006, and it has evolved a lot and improved a lot in terms of detecting and managing global health threats, especially within One Health approach. And Dr. Dunia also showed us the original objective. So do you believe it has fulfilled its original objectives, and how has it evolved over the years? Dr. Ismaila?
Thank you. Thank you so much, Lester. Good morning, good afternoon, good evening, colleagues. Following my colleague's Dunia presentation, where she mentioned then the GLUs Plus was established since 2006, we can say that GLUs Plus had made significant progress and achieved remarkable milestone in the global health security. This reinforced its position to play a critical role and to be also a critical tool in detecting, managing, and also health threat at human, animal, and ecosystem interface. As you can know, since now around 19, 20 years after the establishment, we see significant progress strengthening global health security and also global surveillance and early warning system. GLUES Plus has been also playing a pivotal role in identifying and verifying signal of zoonotic disease and other emerging threats. Its role is in early warning or in early detection of outbreaks such as avian influenza, Ebola, and other transboundary disease has proven its capacity to provide actionable intelligence that save life and also reduce risk. In addition to that, I think we can say that significant progress was made in terms of facilitating multi-agency collaboration. GLUES Plus has the best example of effectiveness of One Health approach, fostering collaboration among FAO, WHO, and WOHA by leveraging the unique expertise existing in each organization. In addition to that, we can highlight that GLUES Plus was a very good tool, can help to operationalize data integration. And as mentioned by Dunya, the launch since 2012 of the GLUES Plus platform has been a game changer, enabling the real-time collection, categorization, and visualization of health events. And this tool has enhanced data sharing capability across the organization and country, supporting rapid assessment and informed decision makers. One also additional success achievement of the GLUES Plus is the timely risk assessment and joint action. It's really important that GLUES Plus has been instrumental in conducting joint risk assessment for events of potential international concern, ensuring coordinated and timely response. This capacity has really strengthened the ability of member states and organizations to mitigate impact of health threat effectively. In addition to that, we can highlight many other success like enhancing global disease monitoring, improving risk communication. And the one last thing is really to build capacity on knowledge sharing. This is really very important because GLUES Plus has significantly contributed to strengthening the capacity of countries to detect and manage health threats. To really technical support and training, it has empowered national system to better integrate surveillance and response mechanism. Coming back to the question, for sure, GLUES Plus has made significant progress in achieving its objective, providing its value as a cornerstone of global health security. Its contribution to early warning, surveillance, and response has significantly contributed to strengthen resilience of health system in the worldwide. That's what I can provide as a feedback on the question, and hoping that if colleagues need more clarity and question, I'm ready to provide feedback.
Thank you very much, Dr. Ismail. Yeah, thank you very much, Dr. Ismail. I think it is very clear the contributions on identification of signals, early warning, surveillance, response, joint risk assessments, and of course, the importance of collaboration and sharing of knowledge. So it was well explained and showing how GLUES has really made One Health surveillance possible through this platform. There's a second question for Dr. Itlala Gizo from WOHA. So earlier, Dr. Dunya shared us the process from detection, verification, risk assessment. Could you kindly share us some example of how GLUES has detected and verified zoonotic public health risks, and how have these detections contributed to global health response? Dr. Itlala.
Thank you. Thank you, Lester and colleagues. Good morning, good afternoon. I'm glad to be here today. And that's a really important and interesting question that you've asked and raised. So GLUES has definitely and effectively demonstrated its capacity to detect and verify public health risks. And to exemplify that, I will highlight some examples from three main diseases: zoonotic influenza, Rift Valley fever, and anthrax. In the case of zoonotic influenza, GLUES has been instrumental in identifying, verifying, and assessing the zoonotic risks of influenza outbreaks, particularly avian influenza in humans and animals. Between 2018 and 2023, zoonotic influenza accounted for 29% of the events monitored by GLUES Plus. And by tracking these events, GLUES enhanced international awareness and facilitated timely actions, including issuing alerts, implementing trade restrictions where necessary, and disseminating public health messages to minimize exposure in both animals and humans. And so these coordinated efforts have been crucial in mitigating the public health and economic impacts of zoonotic influenza. Regarding the example of Rift Valley fever, over the years, GLUES Plus has helped identify Rift Valley fever outbreaks through its networks, mainly in the African region. This has enabled targeted intervention, such as livestock vaccination and vector control programs, to significantly reduce disease transmission to humans and limit the impact on animal population. Between 2018 and 2023, Rift Valley fever events made up to 17% of the outbreaks monitored by GLUES Plus, thus underscoring the system's importance in addressing this significant One Health challenge. And the final example, which is anthrax, and it's actually an example from a recent success story of early warning and mitigation through GLUES Plus. So, the recent response to an anthrax outbreak in Africa underscores the critical value of global early warning system in early detection, risk assessment, and outbreak mitigation. The outbreak of anthrax began affecting both humans and animals and rapidly spread across borders, raising significant public health concerns. And so, in response to that, GLUES Plus collaborated with the World Health Organization, AFRO, to conduct a rapid risk assessment, providing timely and actionable insights into the evolving situation. This assessment equipped response teams with the necessary data and guidance to implement effective measures, including controlling the pathogen spread in both human and animal populations. The coordinated efforts played a pivotal role in containing the outbreak and preventing further transmission across the region. While most GLUES Plus risk assessments remain confidential, and we tend to conduct about 2 to 3 perhaps rapid risk assessments per year. A few are publicly available. For instance, the 2021 assessment on SARS-CoV-2 in fur farming animals. So these examples illustrate the system's vital role in addressing complex cross-sectoral health threats through a One Health approach, and overall contributions to translating early warning into actionable responses, strengthening the global health response to emerging threats through preparedness, prevention, and control strategies. Thank you, and happy to take questions afterward.
Thank you very much, Dr. Itlala. Thanks for giving us the three examples on zoonotic influenza, Rift Valley fever, and also anthrax, and for highlighting the importance of the importance of early warning, risk assessment, timely guidance for response in different regions and in countries. So thank you so much. We have a third question here for Dr. Dunya Salanik from WHO. And you have presented us a lot of the overview on GLUES, but what have been the biggest challenges and successes in implementing One Health Intelligence, especially because it is also done through the partnership between WHO, FAO, and WAHA? Dr. Dunya?
Thank you for this question. You was asking for challenges and success, but I will start first with success. So I think creation of GLUES Plus was already the big success because this is unique One Health intelligence system among tripartite for global early warning and surveillance. Also, the GLUES is advocating for transparency in disease and events reporting, which is alignment with the WHO international health regulation and terrestrial and aquatic animal health codes, and also with FAO Empress and general alerts. And in the PowerPoint, I already highlight the success example of this One Health intelligence and show how integrated collaboration across multidisciplinary expertise in recent years has changed detection of disease outbreaks, enabling the swift verification and also prompt response action. This successful outcome of the GLUES collaboration highlight the critical role of diverse health sector in global health security. We have numerous examples that animal disease outbreaks was actually acting as early warning for public, and the public health surveillance was enforced. Also, it was the example where we have that the cases in human was also triggering investigation in animals, and that's exactly the example what Itlala was showing for anthrax and Rift Valley fever. And it's true, we do have the challenges. And one of the challenges, it's coordination across sector. And so we are working with the diverse sectors, which involving human health, animal health, environmental health, wildlife, agriculture, and all these sectors have the different priorities. So due to these different priorities of this sector, it can be delay in the identification of disease outbreaks. We really believe that strengthening One Health approach in multi-sectoral collaboration and transparency, it's really crucial for One Health intelligence. Other challenges is quality of data and integration of the data. So the problem is that different health sectors often have their own separate data system, which are not integrated. And when we receive this data, combining them, it's significant technical and logistic challenges for us. And also resource constraint and capacity. We need a better platform to collect all this data, because One Health intelligence requires systematic monitoring, comprehensive data collection, and robust IT system to aggregate and analyze this data. So the current GLUES platform we use, it was created in 2010, and it's outdated and unable to meet this involving the demands and data management. And this is the current challenge. So there was one question regarding the website. Yeah, we did have a website, but it was really outdated, and we have lots of IT problems with this. So the website is not anymore active. However, we do looking for seeking funding to support us in activities like to again restart the website and creating and updating the GLUES platform, which will have improved technical capacities. Thank you.
Thank you, Dr. Dunia, for sharing with us some of the challenges in coordination, data, resources, technology. But despite these, we also celebrate with you the successes of the GLUES platform, especially in triggering investigations, both in humans and in animals. Thank you very much. We have one more question here, and we can ask Dr. Eliza Palamara from FAO. So there has been a discussion on the platform, on the data. Is there a plan to integrate GLUES with other systems for greater interoperability in the future? and how do you inform the public also of the results?
Yeah,
Um,
thank you for this
so-
question. Yes, there is this plan. There are ongoing discussion about integrating the GLUES Plus platform with other systems, in particular EIOS. I see also in the Q&A there were a lot of discussion about this. EIOS is the WHO's epidemic intelligence for open source, and as well also then with the EIOS directly with the WAIS, the WOA's World Animal Health Information System. And combining these platforms would allow for better sharing of information, making it easier to detect, verify, and respond to the health threats across sectors. Plus, as Dunia also reported, there is the website that is at the moment under construction and outdated, but it's will be very important to overall to enhance the impact and the effectiveness of the GLUES activity. And this aligns with our ongoing search for funding and donor to support to help modernize and expand these activities in order to enable to stronger the early warning response and advancing on One Health intelligence at the global level and contributing to the global health security. Thank you.
All right, thank you very much, Dr. Eliza, for giving us a quick overview here on um, uh, enhancing GLUES in terms of interoperability. We saw a lot of questions actually from the audience, and many of these have also been responded both by chat and also through responses here. An interesting question here is there is a question about the role of countries. So we have been mentioning the three organizations, WHO, FAO, WOHA, but what is the role of countries and of regional offices? Checking with the panelists who can respond, maybe Eliza.
Dunia wants to, I see she,
Yeah,
Dunia, do you
okay.
want?
Yeah, well, anyway,
Oh.
yeah. So I want to say, the country office and regional office have really crucial role because when we, as I explained already, PowerPoint presentation, we do detect some even signal alert, however it's called. So we need to verify that to be sure it's really happening. And this is done by regional office who contact country office and country office contact the ministry. So the role, it's regional office and country office, it's really important. Sometimes, you know that the FAO and WHO have the country offices and the WOA have only regional offices. So sometimes we have information from country office from the FAO because there is no country office of WOA and other way around. So we really coordinate among us from who will receive information and how we receive information from the government to verify the events. Thank you.
Thank you, Dr. Dunya. Yeah, the important role of countries there, and that's from WHO perspective, but we can also hear from FAO, Dr. Ismaila, and also after that from WOHA, Dr. Itlala.
Yes, thank you so much. I think this is a very good question, and often we are doing this early warning, generating the alert, but and so what? There is where really we are expecting really feedback and contribution from the country and regions. Then we, after doing the verification and doing all the necessary steps to be sure that the event or the threat is confirmed and everything, I think that is where action is needed. And that's why I think the response part, early response, is important as a next step after generating this event. And we have a very good feedback from the field where really we are supporting in terms of preparedness. We are supporting in terms of also enhancing capacity, and it's part of also of one of the point of the mission of the objective of the GLUES Plus, and the capacity for them to early respond. And it's really important what we are expecting from country. And I think that will help us to see how we are generating the alert, and after that, how action is taken from the other side, from the region and country. I think that's really important, and I'm happy for them to address this question that will link with contribution of the Dunya for the follow-up and the verification part that need to be done after we generating the signal in the area. Over.
Thank you very much, Dr. Ismaila. Dr. Itlala, you have something to add?
Yes, thank you. I think Dunya and Ismaila have covered it really well. I just wanted to compliment by reiterating the point on Glues Plus being really not just a special system, but the Glues Plus team is fantastic because we tend to use the resources of the three organizations where WHO and FAO would contact their country office and regional office to verify information, and WOA would contact directly the veterinary services to verify this, to verify signals identified, and information sharing does not only go one way where it's to verify, to pick up a signal and verify, but it's also to share back information among the three organizations regarding the output of signal verification, and the role of countries, actually, just going back to the example of anthrax, is really crucial because it's the country that would approach us through WHO or FAO country offices, requesting our support. And that's when we can then intervene and support by conducting rapid risk assessments to support in containing outbreaks. Over.
Well, thank you so much, really, for having a good summary of the roles of country offices, ministries, and the different organizations, considering the different organizational, presence in countries, and information sharing, and also the expertise, the sharing of expertise, which it's really works well with the three different organizations. Anyway, we're moving to the end of today's webinar, and in the interest of time, we, despite the great discussion, we need to close. So let me turn over to Dr. Madhur Dhingra from FAO for the closing remarks.
Thank you. Can you hear me well?
Yes, Dr.
Okay,
Madhur.
okay. Thanks a lot to all the panelists, to all the esteemed colleagues for the very nice presentation and all your contributions during the webinar. I want to highlight that, the incredible progress and the importance of the work that is done by FAO, WHO, WOA, Glues Plus in advancing global surveillance and early warning systems is really important. And as we heard, by detecting, verifying, and sharing data on emerging health threats, Glues Plus has really cemented its role as a vital component of global health security. And I want to highlight that this is the only information sharing platform that exists amongst the three organizations for early warning of emerging risks. Somebody asked, do FAO and WOA collaborate on other things also? Of course, we collaborate on many other things, on AMR, on food safety aspects, now even within the quadripartite framework on environmental health and many other areas of work. So I think it's really important to highlight the transformational power of the One Health approach, which recognizes the inextricable links between human, animal, and ecosystem health. And from the FAO perspective, I'd like to highlight that within our One Health program in FAO, enhancing national and global early warning systems is a core priority area of work for us, and Glues Plus really fits well in that area of work. It was highlighted that the work that we do through a network of decentralized offices, disease intelligence is gathered every day. So it's important to remember that, global health security starts from the ground, and it's important to bring that information from the ground, share it in a confidential manner, convert it into intelligence, and then send the information back to the countries where actions take place. So I want to highlight that this dynamic platform brings together diverse audiences, diverse expertise. It's not just GLUES Plus. When we detect alert and signals, we reach out to our respective technical teams within the organizations and use it for assessing risk or for triaging the signals. And I think it is the dialogue and the knowledge sharing that takes place within the organizations, and also, which is facilitated by EPIWIN, which plays such a critical role in shaping public health policies and practices globally. So a big thank you to EPIWIN as well. As we look towards the future, it is essential to keep this momentum, build this momentum, by fostering collaboration, sustaining investments, enhancing data sharing, and of course, data protection as well, and strengthening collaboration and coordination across organizations, decision makers, and communities. We can ensure that the world remains prepared for emerging health threats. So once again, I'd like to thank our partners, WHO, VOA, our country teams, our regional offices, all of which who contribute every day to this effort of keeping the world safe. And once again, I thank you all for your active participation today and your unwavering commitment to building a healthier and more resilient world. Let's continue to work together to ensure that One Health remains at the core of our global agenda. Thank you, everyone.
Thank you very much, Dr. Nadur from FAO. And very beautiful nuggets there about the transformational impact of One Health, starting from the ground and also sharing of information, expertise, and knowledge. Finally, we are at the end of our allotted time. I will wrap up by saying thank you very much to all our speakers and panelists today, the WHO colleagues who have worked on this, and the EPIWIN team at the back end. Big thanks really to the working team who supported the preparations for this webinar, including the teams, One Health teams from WHO, FAO, WOHA. And finally, thank you all for coming and for your active participation through the Slido survey and through the questions. The recording of this webinar will be available at the EPIWIN website. An EPIWIN digest, a slide set with key messages on this topic, will also be published shortly. If you want to keep updated on future EPIWIN webinars, recordings, and presentations, and the digests, please subscribe to our mailing list. Both links are provided on the chat. And we hope you will also join us for our next webinar. That will be next week, Thursday, December 5 at 1 o'clock Geneva time. The topic is on integrated surveillance standards and implementation guide. Details are posted on the website and are also sent to the mailing list. And for those coming from the United States, happy Thanksgiving. So thank you all and goodbye. See you next time.